Group 10 and our intervention is Madre Sana, Una Familia Sana, which means a healthy mother, one healthy family. Our main goal is to reduce BMI and increase physical activity among Hispanic Latina mothers. Our target population is Hispanic Latina mothers in San Diego County, and we plan on achieving these goals through an intervention that focuses on educating our participants to become more knowledgeable about healthier food choices, also increasing physical activity by identifying and overcoming barriers. Our evaluation questions are:
the theory guiding our experiment is a theory of recent action. We used it because we are dealing with willful behaviors that encompass attitudes, beliefs, and intentions.
The duration of our intervention was for 1 year, and we chose the quasi-experimental research design. The reason we chose this experimental design is because we have supportive and interpretive evidence of program effectiveness, but we cannot control for all factors affecting validity. There's also no random assignment. We targeted a specific group consisting of overweight Latina mothers. We also developed specific intervention protocols to maintain external validity and achieve consistent results. We worked with two groups, an experimental and a comparison groups. Both groups received the pre-test and post-tests, but only the experimental group received the intervention.
We used a convenient sampling procedure which consisted of initial starting population that came from a targeted group of patients from La Maestra Clinic. Requirements to participate in the study included being obese, of Hispanic background, and having one or more child, as well as being low income. The independent variable is the population that we are working with, the Hispanic Latina mothers, which provided nominal data, and the dependent variables were BMI, which provided ratio data, and knowledge, which gave us ordinal data. The measurement instrument used was a pre-test post-test survey to assess knowledge about nutrition and levels of physical activity in both the experimental and comparison groups. We also measured BMI at baseline and follow-up.
Variant data analysis was used in order to determine among our intervention group the relationship between knowledge of nutrition and BMI level. A pre and a post test were administered through a t-test to determine if the intervention group was significantly changed from baseline and at follow-up after intervention. Our statistics indicated that before the intervention, our participants came in as obese, holding a mean average of 32.2 for BMI. And after the intervention, the mean of BMI decreased to 28.8. Therefore, our participants went from being obese to overweight. The t-test was used to test the null hypothesis so that there is no change in BMI. And for alternative hypothesis, it would show a decrease in BMI.
Our findings indicate that Hispanic mothers who participated in the intervention had a significantly greater knowledge increase from pre to post scores compared to Hispanic mothers who were not part of the intervention, proving that our intervention was a success in terms of increasing knowledge. As for BMI, our findings indicate that participants in the intervention group had their BMI either remain the same or decrease, thus proving that involvement in the intervention had an effect on their BMI. Of those who did not participate in the intervention, 3 participants had a BMI increase, thus suggesting once again that the intervention had some effect on BMI.
Looking at the scatter plot of knowledge score versus BMI, we can see that the knowledge score of participants increased post-intervention by 4 points. It can be said that as knowledge score increases, BMI decreases or stayed the same for 70% of participants in control individuals, where only 30% of individuals' BMI increased, but they were not part of the intervention group.
Limitations in our evaluation report based on the quasi-experimental design was that we did not include a measure of BMI during the mid-phase, which may have contributed to the 30% of participants who showed an increase of BMI towards the end. Percentage increase only within the control group who did not receive the intervention. We also need to look at predisposing factors since we did not have access to medical records to confirm other high sedentary behaviors, therefore to minimize self-report bias and increase validity. However, the program did increase knowledge by 90% within our participants through active learning in cooking classes and learning how to read nutritional labels.
Given our findings, we have concluded that our program is effective in changing behavior in Latina mothers.